So here we have the corrective exercises for the lower cross syndrome. So as we talked about before, the low back extensors are usually tight and overactive. The hip flexor muscles are the ones that are overactive for the tonic system. And the opposing muscle groups, the abdominals and glute medius and glute maximus, are the ones that become chronically weak. And that, of course, is in the lumbopelvic region. So Cassie's lying here, and she's going to bring both knees to her chest. This is just a simple stretch. If they find that they have increased lordotic curve, we're just getting that mobility back into the lumbar spine to get flexion. And basically what we're going to do is feel like she flattens out the lumbar spine. So we're not going into a full flex position, just into a straight position. Therefore lengthening the extensors and giving the abdominals the opportunity to take the spine through a flattening out position. All right, and now what I'm going to have you do is come up to a kneeling hip flexor position. All right, so now what I want to have Cassie do is contract her gluteal muscle on the right side, contract her abdominals, and then move into the stretch. There you go, until she elicits a stretch in the front of her hip. So we're stretching the hip flexor group, the tensor fascia lata, the iliopsoas, the sartorius, and even in some of the adductor muscles. All right. By contracting the glutes and the abdominals, we actually stabilize the pelvis and emphasize more of a stretch on that hip flexor group. So again, stretching the tonic muscles while activating the phasic muscles. Now we can do other things to emphasize stretch by raising the same side and having to reach to the ceiling. That will actually stretch that whole lateral side. I'm going to move her forward a little bit more into the stretch. We can tie into that latissimus dorsi that we mentioned before in the upper cross syndrome. That muscle comes down and attaches along the lumbar spine and into the posterior part of the pelvis, which can create an anterior tilted force. So by stretching this out and contracting the glutes and abdominals, we actually integrate the whole body as one to create balance between the upper and the lower cross muscles. Very good, Cass. I'm going to have you now come down onto your back. All right, so stretching out those anterior groups and posterior groups of the tonic muscles, we proceed to the activation component. So of course, the gluteal bridge is one of the mainstays. There's many different ways to activate the gluteal muscles. This is one of my first muscles exercises I go to. I'm going to have you pick your toes up, and I do this for a few different reasons. If you look in your list of tonic phasic muscles, under the phasic groups is the anterior tibialis. Okay, so by having her do a dorsiflexion, I'm activating that muscle. If you look over to the tonic list, you'll see that the gastrosoleus complex are in the tonic group. And of course, we all know that calves get chronically tight on people, especially because we sit, we sleep with our feet pointed, and so on and so forth. So we're going to balance that out. So as she's working here, they're working just to stabilize her ankle joint and getting dorsiflexion. The other reason why I like to do this is the hamstrings have a tendency to cramp up on somebody doing the bridge. So as Cassie does the bridge, I'm going to have her exert force into her heel like she's going to extend her knees. And that's going to activate the quadriceps, which are our phasic muscles, and deactivate the hamstrings, which are tonic muscles. So again, it's using neurology, using reciprocal inhibition to actually balance muscle systems as we're going through motion. So abdominals are going to be braced, glutes are going to be tight, and you're going to pick your hips up as a unit, keeping your spine straight. There we go. We're not looking for any spinal rolling or anything like that. That is good for mobility purposes, but for this exercise, we're emphasizing hip flexion and hip extension. Particularly extension on the way up, flexion on the way down. Okay, go ahead and lower, and up again. Squeezing the glutes as maximal contraction as you can get to facilitate. All right, and back down. Nice job. And up again. Another technique that I do is a strap around the knees to have them exert a force into the strap or into my hands for this matter. Go ahead and push out your knees into my hands. Very good. By doing that, that's going to activate the deep external rotators, the glute max, and the glute medius far more than just keeping neutral. And coming on down. And it's another beneficial way to keep the hamstrings out of the equation. Because oftentimes you'll have people that can't do this because of the hamstring cramps. And back down. Very good job. All right, so now we're going to go on to the clamshell. And you lie on your side, Cassie. What I'm going to have you do is start at 0 degrees. I like to go through the clamshell 3 different degrees. All right, that's going to emphasize each external rotator a little differently. We can use the weight of the leg or the little strap around the knees. Okay? So what we're going to do is be sure that the pelvis doesn't compensate by moving posteriorly. As a matter of fact, we should have a slight anterior roll of the pelvis. All right, go ahead and rotate your knee up and back down. And give me a few of those. Perfect. So you'll notice as people really want to do well, and they'll try to pick their knee up as high as they can. Well, they're going to run out of room eventually, and you'll start to see this, especially if they start becoming fatigued. So if you can hold your hand here to stabilize their pelvis as they go through, then they're going to facilitate and isolate those muscles of the rotator group in the hip. Also, you can have them simply check their own hand and train this exercise for isolation purposes. Now we're going to go up to 45 degrees. There you go, and a few more repetitions with the same emphasis on the pelvis. Of course, the abdominals are activated. Okay, and right up to 90 degrees. There you go. And 10 to 15 repetitions on each angle is efficient. Very good. Excellent. Now I'm going to have Cassie straighten her leg out. All right. And we're going to look at the hip abductors, which are the other part of the phasic muscles. However, if we look at the anterior component of the hip abductors is the TFL, and the posterior part is the glute medius. The TFL is a tonic muscle, the glute medius is a phasic muscle. The TFL is going to try to take over and do hip abduction. So when we see that, people raise their leg and they come into hip flexion. And of course, they also can come up into hip hike position, which is the quadratus lumborum, which is also listed in the tonic muscle group. So what we want to do is emphasize that there's no pelvic movement here. And we can take Cassie's hand, place it right on top of the pelvic rim here, contracting the abdominals, and cueing that she lifts up and extends slightly her hip. So going into extension. And then coming down slowly, and then coming up before again. And then this will allow isolation of the glute medius without compensation of the TFL. I like to go into dorsiflexion, knee lock position, because again, we're addressing this calf musculature of the tonic and phasic system. And back and down. And up. Good. Maybe even holding for 8 seconds at the top. And back down. There we go. And back down. Perfect. And these are some quick exercises that you can do to correct the lower cross syndrome.